I'm so glad to have Dr. Amir Yazdan on the program today. He specializes in hair restoration and more. Hello, Dr. Yazdan. Welcome to It's Your Health.
Hi, thanks for having me.
It's so nice to have you on. Now, I was looking at your website, Modena Hair Institute, and I like the way it's described that you have a progressive edge. Talk to us about that, and what are some of the latest and greatest technologies now for hair restoration?
Well, you know, one of the newest technologies for hair restoration is called an FUE procedure. It kind of gets away from the older method, which was called a strip procedure, and with the FUE, it's really nice because patients can get a really good result with minimal scarring, and that's the biggest thing. People are worried about having the old big line across the back of the head, and with the FUE procedure, you can kind of get away from that and go towards something that's a little less invasive, very little risk of scarring, and patients get very good results.
Oh, that's great. Now, what got you interested in this field?
I've had a lot of patients in my practice that were kind of, losing hair and not looking as well, and it was primarily men. And I work in the ER every once in a while, and I had a patient who had come in and they were actually they were burned, and they had lost lots of hair, and part of the process, left them with lots of scarring in the scalp. And it kind of caught my interest at that time that, this could be something that could really help patients with their self-esteem, their motivation. And so I kind of got into the field during that time. And from that point on, I've primarily focused my practice around the hair restoration surgery, and I've developed some of my own tools and some of my own techniques for doing the procedure.
Well, I'm looking at the before and afters on modenahair.com, and I have to say I'm really impressed. It looks really great.
Yeah, absolutely. The goal of the procedure is to give patients a very natural-looking appearance. I mean, nobody wants someone else to know that they've had a hair restoration procedure, and it's important that the case is always done right. It's done properly, and if it is done the correct way, you can see that the procedure looks very, very natural, and it's really your own hair, your real hair growing, in areas where you didn't have it before.
And tell us how it's taken from an area in the back of the head, correct? And then how is
Correct.
it transplanted, or what is that the word you would use, or to?
Yeah, it is grafted or transplanted.
Okay.
So again, there's two ways for the hair restoration procedure. One is the strip method, which is still a good method, but it's for certain patients are good candidates for the strip. And the newer method is the FUE method. Both of them are single follicular unit grafting. With the strip method, you cut out a strip from the back. That gets dissected with under microscopes into single follicular units, and then we regraft them onto the areas which would be, for example, the crown, the front of the head, the hairline, areas where patients have lost hair to get them the result that they're looking for. The FUE procedure, you're punching out individual grafts one at a time, and then those grafts again are placed the same way as the strip procedure grafts are placed. It's just the extraction of the grafts is a little bit of a different process.
Now, how long does this procedure take?
It all depends on the patient. If you're going to do a strip procedure versus an FUE, since FUE is the thing lots of people are going for these days, we can kind of focus on that maybe. And I'd say a good FUE procedure, which would probably get you about 1,500 to 2,000 grafts, on average takes somewhere between 8 to 10 hours. So it is a long procedure, but it's long for a reason, and that reason is that it takes time to do good quality work, and you don't want to rush the procedure to compromise the quality.
Now, is this person under a local sedation of some kind? Because that's a long time to keep someone under a general anesthesia, correct? Or how does it work?
Correct. So, usually I orally sedate patients with maybe like a Tylenol number 3, which makes people a little drowsy, helps them sleep a little bit. That's for the beginning of the procedure while we're extracting the grafts. After that, patients are pretty much awake the whole time. They're watching movies, they're on their phones, They're on their iPads. I mean, I've had real estate agents selling homes on their laptop in the middle of the procedure. So they are awake during the procedure.
Okay.
But, you know, we do give them a little bit of oral sedation, and they have local anesthesia on the scalp.
Now, is this something that once they get this done, how long does it take for the hair? Does it have to regrow? Is it there right away? I'm completely new to this, so fill us in.
Sure. That's a very good question, and it's something most people don't know. So with hair restoration procedure, you know, there's a time. It's not an immediate result. Most people are looking for that. I get a procedure done and I have a result the next day. That's not quite the way that it works with the hair procedure. In a nutshell, when we do the procedure, we transplant the grafts. They fall out within about 2 to 4 weeks. We see patients start kind of shedding those grafts. The grafts then go into a bit of a dormant phase, which is kind of like a sleeping period for the grafts. And that, on average, lasts around 2 months or so. So patients at this point are kind of looking like, what happened? Where, you know, I had this procedure done. Where's the hair? And, you know, at that point, they kind of start seeing little hair growing out, little stubbles, and it starts to grow from that point on. So patients start to see results at about 3 months after the day of the procedure. They start seeing very good results at around the 6-month mark. And they see the full results at about a year out from the day that they had the procedure done.
Now, is this hair always going to stay there, or does nature take its course and they might have to do it again someday when they're older?
So, no, that hair is actually going to always stay there. The hair is being taken from the back of the head, where that hair is actually resistant to DHT, which DHT is a substance in the body that's known to cause hair loss in certain hairs. And for whatever reason that we don't understand yet, some hairs are resistant to the DHT and some are sensitive to the DHT. And some of the products that are used for keeping your hair, what they do is they lower the levels of the DHT. Now, we're taking the hairs that are resistant to DHT, and so when we regraft those, patients keep those lifelong. The second point of your question is, would they need a procedure in the future? Well, that depends on a patient who, you know, let's say they had a lot of hair and they're just kind of filling in some areas. If they lose some more of their original hair, then sometimes patients want to do a procedure in the future. Most of my patients, I will start them on usually Rogaine, which helps kind of slow down the hair loss quite significantly in a lot of patients. And those people usually may not need a second procedure in the future.
Okay, now that makes a lot of sense. So the hair that's transplanted is going to stay. It's just the hair around it that wasn't transplanted could go. That makes sense. Okay.
Correct.
All right. Now let's talk about some of your reconstruction in terms of folks with burns or eyebrow issues or other things. Talk to us about that.
Sure. So one of the things that I've actually been really specializing in is some of the more difficult cases. Lately, I've actually been doing a lot of scar revisions for patients that had strip surgeries before that have left them with very poor scarring in the back of the scalp. I do actually have a video on my website that shows a recent case that I did from a patient who had 2 procedures in the past. They had very poor scarring in the back. They had, you know, an ear-to-ear scar that was very wide, raised above the skin, and I used the FUE technique in order to kind of regraft hair into the scar to try to minimize it. Some of the other stuff that I've done reconstruction-wise, I've done 2 patients that have been burned. I have done, again, reconstruction where we did body hair transplant and also hair from the beard onto the scalp. I've done a few cases of eyebrows where patients, women, had chemotherapy. They underwent chemotherapy for breast cancer, and with the chemotherapy, they lost their eyebrows. And usually the eyebrows don't come back. So one of the nice things with the FUE procedure was we were able to get some grafts and put them in the eyebrows and recreate an eyebrow for the patient.
Oh, that's incredible. And I see on your site you have surgery for eyelashes as well?
Yes, absolutely. Eyelash is another one that I've done. I had a patient who they were having a barbecue, and when he lit the barbecue, the flame kind of shot in his face, and at the same time, it took out his eyelashes and his eyebrows as well. So that patient, we did an eyelash transplant as well as eyebrow transplant.
Oh, that's so interesting. Now, another thing I'm seeing on your site is it says all our procedures are done with coronal angle grafting. Did I say that correctly?
Correct.
And what is
Yes,
that?
you did. So there's two different ways of creating recipient sites. One is the coronal angle and one is the sagittal angle. And that really goes to the way that the sites are placed for the hairs to be put in. The coronal angle grafting is kind of, I feel it makes the results look more natural. And if you see some of the cases that I've posted on our website, the before and afters, it looks very natural, and I think that has to do with the coronal grafts or coronal angles that we create for the grafts to be placed into the scalp.
All right. Well, it just sounds amazing. I mean, what rewarding work, because you get to see people so happy afterwards.
Very, very rewarding. It's something that I have some patients who it's really changed their lives. I did have a female patient, very, very nice woman who had lost hair pretty much in the entire center of the scalp, and it was almost creating some amount of depression for her. She wasn't leaving the house as much, wasn't going to family functions because she had, lost this hair. And, after her procedure and once she started getting her results, I mean, it almost changed her as a woman. It was just such a nice thing to see, as time went on and I had follow-ups with the patient, how much of a difference in self-esteem it also created.
Oh, I'm sure. Now, is this usually due to alopecia? Is that one of the reasons you see women in addition to chemotherapy?
I do. There is a female pattern baldness that I see a bit of. A lot of the other stuff that I've seen in female has been from hair products. They've used types of chemical straighteners, types of hair bleaches and dyes, and it's damaged their hair follicles. I do see quite a bit of that where they actually get a chemical alopecia. The chemicals cause scarring to the scalp and to the hair follicles, and they really start losing the hair. And that's something that I've been dealing with a bit in the last year or so.
Well, Dr. Yazdan, this has been fabulous. How do people learn more?
How do they learn more?
Yeah, what's your website and all that good stuff?
Yeah, a great way is to check out my website, modenahair.com. There's some videos on there that actually show the procedure being done from beginning to end. There's also some very good hair transplant forums online that they could search, and patients have kind of provided their own results and their own experiences. There's a wealth of information on some of the hair transplant forums as well. There's just great resources online. There's another very good resource online, which is called the ISHRS, and that's the International Society of Hair Restoration Surgeons. And there's good information that can be found on that website as well. Oh,
that's great. Now, Dr. Yazdan, I'm guessing that price-wise, you don't have to give us a price, but is it similar to some of the cosmetic surgery procedures? And is there, I saw on your site there's financing, because I'm sure it's like a cosmetic procedure. It's not covered by insurance, or is it sometimes if there's a medical reason? How does that work?
This is really a cosmetic procedure. I don't know of any insurance companies that do cover a procedure like this. On average, cases go between $5,000 to $15,000, depending on what needs to be done, and if it's one procedure or two procedures, if it's FUE versus strip, number of grafts. So it really varies based on the patient. And we do have financing programs as well, which really help patients, makes the payments a lot more affordable. And a lot of patients seem to use the financing and really like that option as well.
And where are you located?
I'm located in Irvine, California, and we also do have a clinic in Las Vegas, Nevada. So I travel between the two clinics and kind of serve the population of Orange County, California, as well as Las Vegas.
Now, I'm guessing you probably have people that come from other parts of the country to see you?
Absolutely. I've had patients coming from Europe. I've had quite a few patients coming from Canada, patients coming from Australia. So I do get a lot of patients that come internationally. We do pick them up from the airport. We set them up in a hotel. We bring them to the clinic, do their procedure, do their follow-up, and then when it's time to go, we give them a ride back to the airport, and they're kind of on their way to go.
Oh, that's really nice. Well, give us the website one more time.
It's modenahair.com, MODENAHAIR.com.
Thank you so much, Dr. Yazdan. I really appreciate it.